Thanks for joining me for another podcast episode. Being diagnosed with a life-threatening illness can be devastating. My mom, I think you know by now, was diagnosed with dementia in 2018, and I was in denial because I didn't see anything huge, any big changes, like serious changes. But over time, I started seeing those changes and watching the effects of the disease really start to encroach on her life. And there's still some days that I just cannot believe that it's happening. There's so many emotions involved, which is why I am so intrigued by this woman who is with me here. This is VENA PATTON. She was recently diagnosed with Alzheimer's disease, which is degenerative, and it slowly, changes your mood, your memories, being able to remember, the way you act. But the joy that you have found, and part of that is the medications that you've discovered and that you're taking. Mm-hmm. But what really intrigues me even more than that is the joy that you maintain. I mean, your attitude is amazing, and every time I talk to you, it's been a couple of times, I can feel your energy, even if it's over the phone. So let's start from the beginning. You told me you are not going down without a fight.
I'm not.
I love it. So tell me first about the diagnosis. Where were you? How did you get the call? Or was it something that you noticed first?
I started to notice, and I noticed it because I went through the diagnosis and the whole disease to the end, to where my parents both died. Both mom and dad had it. Mama was diagnosed, she was sick with it for 12 years. They both died 31 days apart in 2020. And then daddy had it for 4 years before he died. And so I know I was able to recognize the flags.
So what did you see with your parents? And that must have been so, because it's hard for me with my mom's dementia, it's heartbreaking.
It is.
So what was that like for you, watching your parents go through this?
It was sad. It was heart-wrenching.
Yeah.
And just seeing them deteriorate and nothing I could do about it. But I did learn quickly to not ask them questions and to time travel with them. Mm-hmm. So when daddy was a child and I was his mother, he thought I was his mother, I just rolled with it and I played the part.
Yeah.
When mama quit talking and had lost the ability to communicate, I would read to her, I would sing to her, I would just be with her.
Yeah.
And just watching them deteriorate, though, was heart-wrenching.
And you were telling me that it got to the point where they didn't even recognize each other, even after decades of being married.
67 years they were married, and they didn't know each other at the end. But they were connected, because the doctor said that when daddy died, and we told mama that she wouldn't know what we're saying. But she had a stroke 2 weeks later, and 2 weeks after that, she died.
Oh, wow.
She knew. They were connected.
You could feel that.
I could feel it.
Gosh, so then what was it that you saw with yourself that led you to believe, hey, maybe I should get this checked out?
Mm-hmm. I was becoming very forgetful in conversations. Couldn't come up with the words. I would just be at a loss for words. I was being confused a lot of times, and the last straw was when I wasn't keeping up at work, and I said, I need to get this checked out.
Like, what do you mean wasn't keeping up at work? Like
with the productivity and making mistakes, and that's not like me at work. I've been there 26 years, so to not be able to keep up with something I've done for so many years. Yeah. That was definitely a red flag. And
do you mind, you don't have to talk about where you work, but what type of work is it? Does it deal with numbers or computers?
I do a lot of coding.
Oh, gotcha.
A lot of coding, yes.
And you were finding that you were making mistakes.
Mm-hmm. Well, and I wasn't able to keep up with the volume.
And so what did you do? You said to yourself, I know your thoughts went to your parents.
Oh, definitely, definitely.
Did it scare you?
It did. But I do this walk every year. I've been doing the walk since Mama was diagnosed.
Walk to End Alzheimer's.
Yes, and I
Yeah.
do it every year. And 14, 15 years now.
That's
And,
great.
Yeah, and it's the Alzheimer's Association. I'm an advocate for them now, and they just have done so much, and I learned a lot from them. And then at the walk, they have booths set up everywhere, and one of the booths was a neurologist. His name's Dr. Manel. So, and I got a card from him one year. So when I started having signs or symptoms, I pulled out that card.
You kept it.
And
you
I
held on
yes,
to it.
and I called his office, and they saw me right away. And there was an array of tests that they did to rule out everything else, and then blood work showed that I have a copy of the genotype 4, and I could have had 2 copies from Mom and Dad. So having one is better than 2, but nevertheless, I still.
That's incredible that they were able to do a test to tell you that you had the gene, number one, and whether it came from your mom or your dad?
They don't know which one. But,
okay.
But I don't know which one either, but I got it from one of them.
Yeah.
And that gene in itself is the culprit of me having the disease.
Okay, so in your instance, this is hereditary.
Yes, from my instance, yeah.
So when the doctor told you, what in the world was your initial thought?
Wow. Well, first they finally did a CAT scan with contrast, and that was the final test that revealed that I have it.
And so that's a scan of your brain where they put dye in there, and they can follow the dye and see it really well.
And they saw amyloid plaque, a lot of amyloid plaque.
A buildup.
Yes, and that's one thing that makes a person with Alzheimer's slow down. It slows down their thought processes and gets in the way of things connecting in the brain. So, and then my first initial was, oh no. And so I have a cousin who's a retired doctor from Mayo, and she had a very close friend who's a neurologist. So I got a second opinion. And
Smart.
it was confirmed because my sisters and the people that know me didn't see that in me. Even though I recognized the flags, but like you were saying, you didn't see that in your mom. No. And so many people didn't see it in me. So then my sisters, I have 3 sisters, we're all very close. And so we went on sister vacations, and they said that they would really watch me, and at the end of the vacation, of the week, they would say, we really didn't notice,
Yeah.
So they don't see it, but they're not with me all the time.
So how did they react? Are your sisters going to take the test? Have they taken a test to see if they?
No, they don't want to know.
They don't want to know.
In my opinion, I wish they would, because early intervention is what's helping me, because I'm going down fighting. I may not go down. They may have a cure, But, I got on the medicine right away. Last year I got on the Lequimbi, the IV treatment. It was every 2 weeks, and I hate needles. Like,
oh my gosh.
Needle phobia.
I'm with you on that.
So my friend Llewellyn would come with me, and she's over there laughing because she always has to leave the room when they put the needle in, because I'm
But it's okay that your sisters don't want to know, and everybody reacts differently to it.
I respect that decision, but getting on this Lequimbi, and which I'm so blessed. I'm so happy that they've got medication out there now. Really made a huge difference with my thought process, with my everything. It just helped me all around. And so my last treatment was July 1st, and with this new treatment, and I'm excited about that, because the new treatment's only once a month that they have to put a needle in me.
So this is the drug that was recently approved by the FDA, like just about a month ago or so. Kisunla. Kisunla. I think I'm saying that right. But this is brand new, and so you're going to be able to take that.
Definitely. I have to wait a month from the last treatment of Lequimbi, and I see my doctor, Dr. Manel. I see him Monday, and he already called me and told me that I'm a candidate, that I'm approved, and I can get on the new treatment.
That's you're like lighting up. This is where you've discovered your joy. It's like you're just, I feel your excitement. Can I ask you, because you do have children, they're grown, how did you tell them? How do you tell people who love you so much that this is happening? I
told them in person the best I could. I have 7 grandchildren.
Wow. What a blessing.
But I tried to tell them in person, and they were very concerned. And my first reaction after having it confirmed was, oh my gosh, I need to make plans. I need to make plans such as hire an attorney to make a will, to do a surrogate will, to do the living will, to do the power of attorney, and get all that aligned for when I lose my pea-picking mind.
But how do you, it's really difficult for a lot of people to do that, because you're talking about end-of-life directives, like you're talking about your mortality. So how were you able to do that and be strong enough to do that? Or did you break down while you were doing it? I don't know. Tell me, how do you do that?
I rely on God, you know, and God is my source of energy and of joy. You know, that's, and I have a network of women, of strong women that are absolutely incredible. They are just, they're there for me, my neighbor, my best friend. I have women from from high school and from middle school that we're close, and you know, and I have a program that I go to, and there's just a group of strong women, and they're always there for me, no matter what.
So that's really important, it sounds like, to entrench yourself into positive and supportive people.
Yes, yes. And don't be afraid. Yes, I have early onset Alzheimer's, but that doesn't scare me now. You know, at first it did, like, oh, I need to set up where I'm gonna go live, where I'm gonna, all this stuff. Well, I did set up all the legality stuff. And truth be told, I should have had that done anyway. You know, that's a good idea for anybody to do.
Was it a difficult process? Because it sounds really daunting. You know, I get the will and your estate, or, you know, I don't know the wording, all of the legal mumbo jumbo, but, you know, then you've even gone as far as to think about, you know, if you have to go into an assisted facility or a nursing or home or something, you've thought about all of that. Was that hard? Like, where do you even start?
Well, I started with hiring an elder attorney, an elder law attorney, an attorney that knows about old people's laws, laws for old people.
Yeah.
I'm 64 now. And
you look fabulous, by the way.
Thank you.
But yes, continue.
But yeah, and so I'm really grateful that I got that done, because you know, everybody should have that done if they're in their 30s or whatever, because you never know what's going to happen. I lost a husband when he was 39. I was 40. I was in my early 40s, so I know firsthand that anything can, you know. So the legality, all that stuff, that I should have done that a long time ago. So it made me feel good to do it, because it needed to be done, and I did it, and I'm real grateful that I did that.
It seems like you have peace of mind.
I do. Okay. And you know, going through it with both of my parents also I think that helps me to go through this, because I don't feel alone. I have 3 amazing sisters, amazing friends, and I love the Lord. You know, He's got my back.
And I know your husband is here too. And that's got to be a challenge sometimes, because I would imagine there's some days where you're just like, why? And who do you vent to but your spouse? So
I vent to the women in my life.
Yeah.
I do.
And I'm sure it's helpful to have him here as well.
Oh yeah. Yeah.
When it comes to the medicines, they're not cures. And I know you know that. How do you settle that in your mind?
Because I know that the medicines, the oral medicines I've been taking since the diagnosis, and the treatments, especially the treatments, help me to think clearer longer. If it weren't for the treatments, I don't know what condition my brain would be in today. But because of those treatments, I'm able to work, I'm able to still work, I'm able to function, I'm able to do everything normally because everything's connecting up there like it's supposed to. And I know the disease, it doesn't slow the disease itself down. So I don't know how long I have. So I live every day to the fullest. I have a bucket list and I've been filling it up and doing it.
Really? Tell me about some of those things on your list.
Okay. One of the things was to go to Alligator Farm in St. Augustine. And zip line the course, the entire course. It was fun.
Did you do it?
I did the entire course with my grandson.
Over top of the alligators?
On top of the alligators. It was
crazy.
An obstacle course too.
Oh, wow.
There were times that, whoo.
Yeah.
But it was so much fun. That was on my bucket list. So, yeah. Another thing on my bucket list is to jump out of an airplane.
Why? Why does that seem to be on everybody's list? It is definitely never going to be on mine. But you want to do.
Sounds like fun.
Wow.
So I want to do that, and I want to, even visit all the beaches in Florida. Just take like weekends or whatever. I haven't done all that yet, but I want to go to Alaska to do that trip because Mom and Dad did. And they loved it so much. And so,
I was going to say, you're from Florida, it's hot. I can understand why you want to go to the cold.
I don't like the cold.
But that should be amazing.
Yeah.
Wow. And you also told me that you're thinking about years down the road. You've talked to your doctor about a possible cure in the future.
Yes.
So what was that conversation about?
Well, I read online that they were shooting for, I think it was 24, so it was like 27 for a cure, but they've bumped it up to 2030.
Okay.
And I'm like, they can keep my brain clear that long. And I stay active. I do gaming, and I read, and I do challenging things that challenges my brain. And I want to go back to school, and I've got 2 classes left to get my degree, and I want to do it.
That is fabulous.
I don't see anything holding me back. Now that with the Leqembi and now the new medicine, I can think clearer longer. And I want to do it. That's on my bucket list too, to finish my degree.
So what about, there are folks who are out there who get diagnoses like this, or they receive some type of bad news, and it's really hard to ingest that. So what do you tell them? What kind of advice would you have?
Turn to hope. I don't get lost in the what ifs. What if I don't live long enough? I don't get lost in that because that will suck me in quickly.
How do you not get?
I refuse to do that. And I pray, I meditate, I read. In my case, I believe in God and Jesus, so I read the scriptures. I read, and I always read something funny. I love to laugh. And I think that having a funny bone is it's important. It's important. And so I oftentimes will send funny, I collect funny things, like little comedy stuff, and I'll send them to my friends, blast them out several times a week, sometimes once a week. But I share my joy, because if I don't share it, then I'm not going to have it. Does that make sense? I can't keep it unless I give it away.
I think so.
Yeah.
Yeah. So, and when it comes to your friends, your family, have you already told them things that you want them to know? Are you leaving letters? Like, how are you handling that part of it?
That's a good idea, to leave letters.
Oh.
I think I'll do that. That's a great idea.
Well, I'm glad I could help.
I like that.
I didn't know if there was anything special, but you did say you're living every day
to its fullest.
Yeah.
Yeah. To its fullest. Yeah.
Which is awesome.
Yeah.
Well, I thank you so much for sharing that with me, and I hope people see your energy and they're inspired by it. How can you not be?
I texted my granddaughter today, and I said, I choose today to drive forward and not look into the rearview mirror. Because if I'm driving today, looking in my rearview mirror, I'm going to wreck. And that will make a disaster of today and my tomorrows. So just keep my eye off of the rearview mirror of the past and just move forward every day. And I keep hitting this, I'm sorry.
That's okay. I love that analogy.
Yeah.
That is amazing. And you can use that in any kind of instance that you go through.
This is not a death sentence for me.
Oh, no.
It's a life sentence.
What does that mean?
It means to live life to the fullest every day. Every day, reach out and help somebody. Get out of myself. Help somebody. Make this life worth it every single day.
I wish I could just stay here, just soak up your energy level. It's great, and your positivity.
And my note to anyone out there who has parents or loved ones, whether you're a caretaker, get checked. Just get checked. If you're having symptoms and you're concerned, go to a neurologist. It may be just vitamins that you need to take. It could be something simple like that. And if it's Alzheimer's, then find out early so you can do something about it. Because if I didn't go get diagnosed and have early onset Alzheimer's and it go into the full Alzheimer's, it would have been too late to get the treatments that will prolong my life.
Good advice.
Yeah. And be happy about every day. No matter what.
You're awesome.
There's going to be sadness, but that's just life. There's silver linings to everything.
How do you keep those negative thoughts from growing?
I just stomp them. Yeah. And when I start to get real negative, I reach out and help somebody.
You don't ask for help, you go help somebody.
Yeah, I go help somebody. I'll call somebody, how's your day? Get me out of me. And that helps me.
I like it. I'm gonna have to try that next time.
I'm telling you, it works.
Thank you. Thanks.
Thank you.
So I just left VENA PATTON's house, and I wanted to find out more information about the treatments she's receiving now and the new treatment she's about to receive, the one that was just approved by the FDA recently. So I contacted the Alzheimer's Association, and they asked me to give Mayo Clinic a call. Dr. TIPTON, thank you very much for your time. I appreciate this. This is a follow-up to an interview that I did with a woman who lives not too far, who is living with Alzheimer's. And her attitude is amazing, but she talked about some things that I want to get more clarification on, more information about. So thank you. First of all, she talked about the signs she noticed in herself that other people didn't see that led her to think something was wrong. How do you know the difference between forgetfulness and actually something as serious as Alzheimer's?
It's really tough. First off, thanks for having me. It's a pleasure to be here. But it's very tough. It can be incredibly tough to know, is this just normal? I'm forgetting my keys, or is there something more to it? I think that some of the things we look for are, is it consistent? Are you consistently, forgetting your keys, or are you getting lost in familiar environments? But sometimes it's more subtle than that. And so my blanket statement is, if you have any concerns, that's when it makes sense to go and talk with your primary care provider about it, and they can determine whether or not additional workup is necessary.
Now, if you can clarify, because my mom was diagnosed with dementia, what is the difference between Alzheimer's and dementia, or is Alzheimer's under the dementia umbrella? How does that work?
You nailed it with the second. I'm glad you asked the question, because we get that question a lot, and oftentimes we'll kind of throw those terms around like they're the same thing, and they're not. So dementia is when you have cognitive impairment. So cognition, talking about memory, thinking, concentration, those types of things. When you have cognitive impairment that's a change from somebody's baseline, we can measure it on cognitive tests, in-office tests, all sorts of screens that we can do. And it's severe enough that it interferes with someone's day-to-day activities. So maybe you're having more difficulties balancing the checkbook, or you're getting lost in familiar environments, or having trouble remembering to take your medication. So that's when it's kind of interfering with day-to-day activities. Alzheimer's disease is a cause of dementia. So dementia is nonspecific. It's just like it's a symptom, really. So you wouldn't be very pleased if you went to the doctor with a cough and they said, well, we know what you've got a cough, end of story. You'd want to know what's causing the cough. And so Alzheimer's disease is the most common cause of dementia.
Okay. And I'm sure you've seen countless people who have come in, and at that point, do they know they already have it by the time they see a neurologist? Or are there some people that come into, I've got to see a neurologist, I don't want to go to a primary care? Which type of patient do you deal with, and do you recommend someone go to their primary first?
Yeah, we see a little bit of both, honestly. Okay. Some people, particularly kind of with the case that you just described, where someone might be noticing a little bit of something and they're concerned about it, they're really concerned about it. They may just go straight for a neurologist and say, I want the full workup, whatever that means, and do brain scans and whatnot, just to really try to drill down on it and see if there's something there. But I think it's perfectly reasonable to start with your primary care physician to just see if there's anything worth pursuing. But oftentimes when people wind up in my clinic, so I do have a dementia clinic, and so there's already significant cognitive impairment. We may not have put a name on it in terms of the underlying cause, but we know that there's some cognitive impairment there. And so oftentimes what we're trying to do is to figure out, is it Alzheimer's disease, or is it another form or cause of dementia, because there are many out there.
Do you recommend, because I know this may start out as a lot of back and forth, a family member notices something, but the person who's it affects, they say, what are you talking about? That was the situation with my mom. She type A personality, I'm in charge, you're not going to tell me what my health is. But it was obvious at that point. So do you go with them? Do you bring someone else with you as a neutral party to go with the three of you? In your estimation and what you've seen, what do you do?
Sometimes you got to get a little creative. I think that when we're trying to make a diagnosis of cognitive impairment, dementia, it's always important to have a reliable informant there as well. Because as we've kind of touched on a little bit, there are different stages where very early on, nobody may notice anything except for the person dealing with the symptoms. And it may be very frustrating to them, but their spouse is saying, no, everything looks fine. But then there comes a point where it can shift, where they may not have as much insight into their cognitive impairment as those people around them. And so having both of those points of views, regardless of which stage or condition we're talking about, can be very helpful for the clinician, so that we can kind of put the pieces together. Because there are some causes of dementia where we expect for insight to be less than others. And so that tells us more about brain regions that may be affected.
And talking about this just reminded me, my mom was adamant about not going to it. So we kind of had to hide the fact that she was going for a full checkup, the works and blood work, and just to check up to make sure she was okay, and that was part of it. Yeah. And to have somebody else tell her instead of me, the doctor, the specialist, made all the difference. Yeah. Not that she believed it,
fair,
but but
Yeah.
it was a voice that had backing and the knowledge behind it.
Right,
You know?
right. But I mean, to your point though, bringing in a neutral party can be a very great idea. So sometimes a friend of the patient who can kind of be the neutral party and maybe chime in too, because they could provide a unique point of view. But offering to say, hey, I'd like to go with you. Would it be okay if I joined you? And then I think just as clinicians, we need to set the stage very early on that, why are we here? In terms of seeing if there's something going on. And you may not have to put a name on it. Are we looking to see if there's a thyroid issue going on? Or are we looking to see if there's dementia going on? Either way, it's about a person's health. And we sometimes in our minds, whether we say it explicitly or not, kind of segregate things that we can't see, diseases that you may not be able to see with diseases that you can see. And so I think putting all that together and saying, hey, we're here to just see if there's any issues going on. And then we can start to talk to the patient and things will come out. And so I think going in and trying to lower any tensions that are there are really important, because we want all parties to open up so we have a better chance of getting to the right answer.
So the patient doesn't feel like they're on the defense.
Exactly. Yep. We run into a dead end at that point. So
yeah, gonna pick your brain about this technical stuff. VENA talked about taking a test to know if you're predisposed for having Alzheimer's. What is this test?
So there are a few tests out there. So if we were having this discussion, say 5 years ago, sometimes people would say the Alzheimer's test was getting a gene test. It's a gene called ApoE, and actually I think it's on things like 23andMe and different kind of gene tests that you can get. It's a risk factor for Alzheimer's disease. So it's not actually telling you that you've got the disease. It's telling you if you have certain forms of that gene, you're more likely to develop Alzheimer's disease than someone in sort of the general population, if you will, but not a guarantee.
Okay.
Now, the actual tests for Alzheimer's disease, we can actually look for the pathological changes that occur in the brain in different tests. So that can come in the form of a spinal tap. So we actually take someone's spinal fluid and do some tests on it, and we can identify this thing called amyloid and this other thing called phospho-tau, which are really the hallmark proteins that become abnormal in the brains of people with Alzheimer's disease. Well, we can also do particular types of PET scans. So PET scan is a way, it's kind of like an MRI scan. It's just a different way of looking at the brain, and we can visualize that amyloid. And now it's in research right now, but it's coming into clinical practice. We can visualize that tau as well. So we've got the spinal fluid, we've got imaging, and now we actually have blood tests that are becoming more commonly used yet. I don't know that they're fully prime time yet, so we're not hinging the diagnosis on that, but we've really come a long way from you couldn't diagnose this disease until you looked at someone's brain under the microscope after they've died, to now spinal fluid, to now imaging, and now we're on the cusp of blood tests.
I'm stuck on the spinal fluid thing because that's like a big deal. But tell me, you would not have to do that unless you were pretty sure, or is that something that you do first?
We actually do it fairly commonly. I mean, it's all on a case-by-case basis, and you're right. People aren't knocking down the door saying, sign me up for the spinal tap. But it is a pretty routine procedure when it comes to neurology in general, and it can provide some very useful information. So one of the approaches that I use is when we think this might be Alzheimer's disease, but there are many other possibilities that are on our list. The spinal fluid allows us to check for a lot of things, and so it really just depends on the clinical context there.
Okay, I feel a little bit better about that.
That's why everyone wants the blood test.
Yeah, and this was something interesting. VENA, the woman I spoke with, her attitude was, living every day to the fullest. Alzheimer's doesn't mean you're dying tomorrow.
Right.
So how long a lifespan do you have upon diagnosis? And I know, you could be diagnosed early on, or it could be midway, but how long do you see a person living with Alzheimer's?
Yeah, that's a great question. So you're right. It's not a fast disease. It's not going to change, what the next day or the next week or the next month looks like. This is a slowly progressive disease, and so one where we do expect to see some changes over the course of years, and that certainly affects quality of life. quantity of life, people live with Alzheimer's disease for many years. I mean, sometimes decades with Alzheimer's disease, just depending on, when they're diagnosed. We're learning more about how, all Alzheimer's disease may not be created equal. There may be certain factors that suggest a person may have a more aggressive form of the disease versus a less aggressive form, and that's coming into play in a lot of our clinical trials now. But in general, we're talking about a disease you're going to be dealing with for probably decades.
And you mentioned clinical trials.
Yes,
That's pretty huge, especially here at Mayo Clinic.
Yeah.
So tell me about some of these. How does somebody try them out? Because I would imagine, if I'm diagnosed, I want the latest and greatest. There's something that you think is going to work better than what's on the market.
Right.
Tell me.
Right.
So how does somebody get involved in that?
So the best way is to go to clinicaltrials.gov, and that's a repository of basically any clinical trial that's active, and you can type in your condition, so whether it's Alzheimer's disease or diabetes, and it'll show you all clinical trials that might be available. And so it'll give you information on a little bit of a blurb about the trial, and if it's something that you're interested in, there's usually a contact number, and so you can contact them and get more information. So that's where I typically recommend people to start, just regardless of what cause we're talking about. Here at Mayo, we have the Alzheimer's Disease Research Center, and so we do have quite a few clinical trials that we're running here. Some of those are what we call natural history trials, where someone with a particular diagnosis enrolls, and we follow them, and they get imaging and cognitive tests regularly so that we can really see how does this disease play out. And that goes back to what I was saying earlier about how we're learning that some people tend to have a more or less aggressive form of the disease. And so understanding what is it that makes a disease more or less aggressive may give us insights into how to treat it better. And so the natural history trials are very important. We've learned a lot of important things from that, including ways that we can slow the rate of progression too, which is very interesting. But then there's treatment trials, which is usually what everyone's mind goes to when they think about clinical trials. And so we run several clinical trials here right now where we're using treatments. These are usually going to be big trials, and you may receive a placebo, which means you're essentially receiving nothing, or you may receive the drug. And so with a clinical trial, we always want to be on the latest and greatest thing, but usually these are going to be placebo controlled. So there's always a possibility you may not be receiving the drug that's being studied. But the drug's being studied for a reason, so we don't exactly know if it works yet.
But it's not like you're just like, let me pick this drug and try it.
Absolutely.
By the time they get to clinicaltrials.gov, it's been through the ringer.
Right.
So how much goes into it to get to that position?
And so much.
Do people need to worry? Like, oh, they don't really know what this drug does, but I'm going to take it.
It really depends on the phase of the trial. And so when I'm usually and this is just my personal preference, when I'm usually recommending someone to check out a trial, we're usually talking about a phase 2 or maybe a phase 3 trial. Phase 3 is when a drug's right on the cusp of maybe making it to prime time. So these are big clinical trials. Usually in the case of Alzheimer's disease, we're talking about thousands of people, and it comes after things like a phase 1 trial, a phase 2 trial, where we're making sure this drug is safe, where we're determining what's the best dose. And all of that comes usually after trials in the lab. So whether it's with mice or something like that, where you're trying to understand how the medicine works. So it usually doesn't get to the point where we're administering it to thousands of people until it's really been scrutinized from a safety standpoint.
And if you can tell me about a couple of drugs that VENA mentioned to me, she has been taking Leqembi, it's called, but there's a newer medication that was just approved by the FDA called Kisunla. Am I saying that right?
If you figure out how to say it, you let me know, okay?
I don't even know.
I don't know. I even thought about calling Eli Lilly this morning just so I could figure out how to pronounce it. I refer to it as donanemab because that's the word that we've been hearing for years now. That's the generic name for it.
For this newest medicine by Eli Lilly.
For Kisunla. Who knows?
So tell me, what do they do? And she talks about being able to still work and being able to focus. So what do they do for your body?
Yeah. So let's go back just a little bit because I think there is some context for these drugs is important. So I mentioned that with Alzheimer's disease, we've got two proteins that we talk a lot about. So there's the amyloid, and this is a protein that occurs naturally in us. It gets misfolded and misshapen, and so it doesn't function the way it's supposed to. And so when that happens, it gets sticky and starts to clump up and form these things called plaques. So a lot of times when we're talking about Alzheimer's, we'll refer to the plaques. The other component of the disease has to do with another protein that's naturally occurring in us called tau, and so phospho-tau. And so it also similarly will become misfolded, gets sticky, clumps up, and causes brain cells to die.
Are these normally in our bodies?
They're normally in our bodies, but they're usually functioning normally because they're not misfolded, misshapen. And so when that happens, the proteins no longer do what they're supposed to do in our body, but then they also get sticky and clump up like garbage and cause cell death. So with the tau, we have the tangles. And so a lot of times when we talk about Alzheimer's, we'll say the plaques and the tangles, the plaques and the tangles. That's referring to two different proteins, the amyloid and the tau. These new medications, Leqembi or lecanemab, Kisunla, and donanemab, these are anti-amyloid therapies. So what they are, they're antibodies actually that label, it clears it out. And so the idea is that if you could clear out the amyloid, then you're actually affecting the disease. Okay. And we know from many trials, these are not the first anti-amyloid medications. They're just the first ones that have made it all the way through those trials that we were talking about earlier. So they've got through the phase 1s, the phase 2s, the phase 3 trials, and they've received FDA approval. So these drugs can remove the amyloid, and we know that they do. And past amyloid drugs can remove the amyloid as well, but they weren't showing clinical efficacy. So, I guess no one wants amyloid deposited in their brain, but if you clear out amyloid and yet you have no clinical effect, then really who cares? Because we take these medications to make us feel better. So it's these two medications that have had phase 3 clinical trials that were positive that did show a significant clinical benefit. So we've looked at these anti-amyloid drugs and we can see what happens to their amyloid PET scan, and it clears out the amyloid very, very, very well. But some of these older trials, they would clear out the amyloid, but they were still experiencing the same kind of cognitive decline. There was really no statistically significant change in their rate of cognitive decline.
Okay.
That's the difference with these. Now we have clinical benefit. Okay, so it's clearing the amyloid, but there's also a statistically significant difference that says we're slowing the rate of decline.
So is it not clearing that amyloid fast enough, which is why the decline continues?
I think probably what we've learned from the previous trials is that we weren't intervening soon enough. And so what we've learned over the years is that the amyloid begins to deposit in the brain many years before symptoms start. And then the tau comes and lays down, and that's even before symptoms start.
Can you see them that early?
So we can
Sorry,
see
I'm
them
cutting
that
you off.
no,
This is
that's
so
okay.
interesting.
We can see them that early, but these are really things that we've learned from looking at the brains of people who've died, and so these are changes that we've learned, and also from people who have certain genetic predispositions. And so this is kind of what we call the amyloid cascade hypothesis, where the amyloid is laid down, the tau is laid down, and then sometime later, maybe even decades after the first bit of amyloid is laid down, that's when your clinical symptoms start. And so early anti-amyloid trials were, some of them took all comers. If you were diagnosed with Alzheimer's disease, we confirmed it with biomarkers, the spinal fluid or the PET scan, then you could enroll in these trials, and those trials were negative. They'd clear out the amyloid, but there wasn't any clinical difference. With these two drugs that are now approved, Leqembi and donanemab, they not only clear out the amyloid, but they're for patients with either mild cognitive impairment or very mild dementia. And what the term we use for that is early symptomatic disease. So that goes back to the importance of figuring out if this is what you've got as early as possible, because that's when these treatments have the best chance of helping.
It's so hard though, because Vena was talking about she wanted to get that test taken,
Right.
wanted to know.
Yeah.
She's got 3 sisters
Yeah.
who don't want to know.
Yeah.
So but to attack it the best you can,
Right.
early detection is the key.
Well, we're getting into a stage that honestly, 20 years ago, I don't know that we envisioned being in, where we're almost at the point probably where you may go to your primary care physician and they check your cholesterol, they check to make sure you don't have diabetes, and oh yeah, we'll throw in the test for Alzheimer's disease while we're at it. But that also means that we're probably going to have some positive test results in people that are clinically asymptomatic. And then the question becomes, would you give somebody an anti-amyloid treatment if they don't have any symptoms? Because everything gets more complicated the more we dig into it. We've got people in our brain bank here at Mayo Clinic that had amyloid in their brain, but were asymptomatic. They didn't have any clinical symptoms. So would you expose someone to the risk of a treatment if they were not going to develop symptoms of Alzheimer's disease anyway? So these are all questions that as the technology continues to get better, our ability to diagnose gets better, our treatment options become more prominent or prevalent, we're going to have to answer these questions. So it's a new, exciting time with lots of interesting questions.
Dr. Tipton, thank you so much for explaining that. I appreciate that.
Yeah, absolutely. It's my pleasure.
Wow, that is fascinating.